towards achieving three main objectives: ensuring the health and safety of travelers and transport workers, sustaining the short-term gains in safer, healthier, and more sustainable modes of transport that have been observed during the lockdown, preparing for a possible future occurrence of events of a similar nature, and responding to all transmission scenarios. Central to attaining these objectives is maintaining the functioning and economic viability of public transport systems while rebalancing the distribution of different modes of transport towards reduced car dependency and increased safe walking and cycling. These shifts are paramount to sustain the positive changes observed in multiple locations during the travel restrictions and achieved various health and environmental objectives. These include reduction in road traffic injuries, emission of transport-related air pollution and greenhouse gases, noise and traffic congestion, provision of opportunities for increased physical activity, and increased flexibility and resilience of transport and mobility systems to face possible future disruptions. This piece addresses the issues by presenting measures that can be implemented in the transport sector by various actors to achieve these public health objectives. It focuses on ways that are existing as provided by WHO guidance on COVID-19 and can be implemented in the transport sector. As governments both at national and local levels have an important role to play in maintaining the trust of users while providing safe and efficient public transport options that can reduce risk and COVID-19 infections. This support may include government subsidies, what the national and local governments can do to assist. Governments at both national and local levels have an important role to play in maintaining the trust of users while providing safe and efficient public transport options that reduce the risk of COVID-19 infection. This support may include government subsidies and investment in public transport sector to compensate for the loss of revenue from lower rates to usage and additional operating costs resulting from new sanitation measures such as more frequent cleaning and disinfection of vehicles. Governments also play a key role in creating the policy frameworks. Governments also play a key role in creating the policy frameworks for promoting safe, active mobility, including through investment in safe infrastructure for pedestrians and cyclists, reallocation for public space, and enforcement of road safety measures. In addition, governments at both national and local levels would play a key role in instituting and enforcing a supportive and coherent regulatory environment in transport and other sectors. For example, governments can support the development and implementation of regulations on heating, ventilation, and air conditioning in transport systems. They can also encourage teleworking through legislative measures, setting and incentives, facilitating and providing incentives. In implementing these changes, government should consider the needs of all transport users, especially those with mobility restrictions, and make sure that the additional measures put in place do not negatively impact access by these people. How the transport providers can assist. Even during the current pandemic, it is important that transport operators are able to offer and manage the essential services that facilitate the safe and efficient movement of people and goods. They are responsible for ensuring adherence to the government regulations and making sure that public health and social measures are followed through specific actions, such as through cleaning of vehicles, disseminating information, and making necessary adjustments in providing services to the public. For example, in terms of services, timetables, and tariffs. They are also responsible for providing safe working conditions for transport workers. In implementing these changes, transport providers should safeguard the mechanisms that are In implementing these changes, transport providers should safeguard the mechanisms that have been put in place. In implementing these changes, transport providers should safeguard the mechanisms that have been put in place to support those with mobility restrictions, including but not limited to wheelchair users, frail older people, and pregnant women. Lastly, commuters should help in the following ways. The responsibility for ensuring that COVID-19 measures are executed effectively in transport system also lies with commuters who are expected to avoid traveling and seek medical care if they are feeling unwell or develop symptoms consistent with COVID-19. They are also expected to observe good respiratory hygiene and physical distancing as they use different modes of transport.